Hello aspirants, welcome to GDC English classes YouTube channel. So in this session we will discuss about the classification of antihypertensive drugs. So mainly for treatment of hypertension, Okay, so here just see the table here. So at which condition we know that is the hypertension, severe hypertension like that. So the general range will be the systolic around less than 20, diastolic will be less than 80. And coming to the normal, the optimal means minimum, it may be less than, and the normal will be 120 to 129 systolic, 80 to 84 diastolic, and high normal 130 to 139, 85 to 89. The grade 1 hypertension 140 to 159, 90 to 99 will be the diastolic, and the grade 2 will be 100% it is systolic will be 160 to 179 and diastolic will be 100 to 109, and grade 3 will be the 180 of systolic and 110 of diastolic, and isolated systolic hypertension 140 and diastolic will be less than 90. So this is a simple table indicates the ranges of hypertension, and in the hypertension there are mainly two types. One is primary or essential hypertension, which is a most common but no specific cause. We are unable to understand what is the specific cause of this hypertension. Coming to secondary hypertension, it is known as non-essential but it is because of renal changes in kidney, changes in blood vessel, and endocrine disorders related with endocrine system, vascular as well as renal disorders. So here our main focus is on the classification. So here these are the list of the drugs helps in the treatment of hypertension. The first category, drugs acts on renin-angiotensin aldosterone, which regulates our blood pressure, nothing but hypertension. In this, ACE inhibitors all prils, enalapril, lisinopril, ramipril, captopril, benzapril, perindopril. All these drugs inhibit angiotensin converting enzyme, prevent conversion of angiotensin 1 to angiotensin 2. If angiotensin 2 not formed, there is no vasoconstriction, vasodilation of blood vessel. Next, sartans, angiotensin 2 receptor blocker like valsartan, olmesartan, losartan, candesartan, telmisartan, irbesartan. All sartans selectively block angiotensin 2 receptor and decrease the vasoconstriction by angiotensin. Next, direct renin inhibitor. 𝘿𝙂𝘋𝘼𝑖𝑛 directly inhibit the renin present in the plasma. If excess renin present in the plasma, that inhibit by using this 𝘿𝙂𝘋𝘼. So renin is one of the major intermediate in the regulation of blood pressure. If renin levels are more, blood pressure is more. That's why we have to control renin levels. And renin release inhibitors are beta blockers because beta 1 receptors also located on the juxtaglomerular cells of kidney. If beta 1 receptors are stimulated in kidney, they release renin. If more renin released, more blood pressure increases. That's why beta receptor blockers are renin release inhibitors, and the renin present in the plasma directly inhibited by 𝘿𝙂𝘋𝘼. Next, calcium channel blocker. So calcium channels on heart as well as blood vessel increase the blood vessel by contractions. So here the list of drugs vasodilators blocks the calcium channel or decrease the function of calcium in the blood vessel and heart and produces vasodilation, decrease the blood pressure. Here the list of calcium channel blockers verapamil, diltiazem, nifedipine. These produce action by blocking calcium channel because influx of calcium into smooth muscle, influx of calcium into heart muscle produces contraction. So verapamil, diltiazem, nifedipine block calcium channel, decrease the muscle contraction, decrease the blood pressure, nothing but hypertension. Vasodilator directly acts on the blood vessel and produces vascular smooth muscle relaxation. So drugs act on arteries and produce vasodilation like hydralazine, chemically thalazine, minoxidil, diazoxide, phenol-dopam, venodilators like nitroglycerin. Venodilator directly dilates the veins. Nitroglycerin dilates both arteries as well as veins. Sodium nitroprusside. Sodium nitroprusside dilates both arteries as well as veins of the blood vessel and produces vasodilation. Regulates the blood pressure, nothing but hypertension. Next, sympatholytic drugs. Sympatholytics. So these are the drugs acts on sympathetic nervous system and decrease the sympathetic nervous system activity. So excess sympathetic nervous system activity increases blood pressure in the blood vessel as well as hypertension with heart. That's why we have to decrease the sympathetic nervous system action. Centrally acting sympatholytic, alpha methyl dopa clonidine. These are the two drugs. Agonize the alpha 2 receptors in the CNS and decrease the sympathetic flow to the peripheral and decrease the blood pressure. Ganglionic blockers like trimetafin, especially in treatment of severe hypertension. Alpha blockers, selective alpha 1 receptor blocker like doxazosin, terazosin, selectively block alpha 1 receptors on blood vessel, decrease the binding of noradrenaline to blood vessel, decrease the blood pressure or hypertension. Next, adrenergic neuron blockers like reserpine, guanidril, guanabenzine. Adrenergic neuron blockers like reserpine, guanidril, guanabenzine. Beta adrenergic receptor blockers, propranolol, metoprolol, atenolol. In the hypertension or blood pressure, there is a overactivity, excess activity of the heart. So to control that excess activity of heart, we have to block beta receptors in heart, causes relaxation of the cardiac muscle, decrease in blood pressure as well as hypertension. So these are the all are the list of drugs acts on sympathetic nervous system and decrease the sympathetic nervous system function and controls hypertension, nothing but blood pressure. So sympatholytics, vasodilators, calcium channel blocker, drugs acting on renin angiotensin aldosterone system. And in the treatment of hypertension, diuretics also will be added. The hypertension is because of excess fluids in the body. To eliminate that excess fluids, we have to go for diuretics also. In the hypertension, the treatment is always starts with the diuretics to eliminate excess blood, nothing but fluids from the body and control hypertension. Control hypertension. So this is simply about what is hypertension, what are the different types of hypertension like secondary as well as primary, and the list of drugs helps in the treatment of hypertension in the possible way of easy learning. So like this interesting videos as well as tricks, subscribe to GDC English Classes YouTube channel. Share with your classmates, juniors as well as seniors, and as well as your faculty also. Thank you.